Many parents out there are growing increasingly fatigued with all the yo-yoing of policies surrounding COVID. I know, I'm one of them. And every week it seems I have to explain to my children why their extracurriculars have been canceled this month, or why they can't meet up with this peer group or that peer group, or why they can't pre-register for any outdoor sports for the summer. It causes anxiety not just for parents, but for children too. And when we look at the science, the hard numbers of cases involving children, it really is becoming quite challenging to accept these restrictions as being grounded in facts. Medical advice has always suggested that there is no need for COVID testing unless you're symptomatic. Yet now, in many schools, voluntary asymptomatic COVID tests are happening. And God forbid your child tests positive, you might be required to isolate your child in a separate place in their home, away from the entire family, with no contact with anyone in the household. And perhaps what is most concerning is the deteriorating state of mental health of children in Canada due to the COVID lockdowns. A McMaster Children's Hospital report compared a 4-month period during the pandemic versus 1 year before, and has revealed some chilling stats. A 90% increase in referrals to its eating disorder clinic. Substance abuse disorder admissions have doubled, and youth seeking medical help after a suicide attempt has tripled. Is this surprising? Not to me. Most children thrive on routine and stability, and this past year has given anything but. And many children want to be in schools or with their homeschool co-ops, but around every corner, it seems there is another school lockdown and kids are sent to their homes. But is this fair to the children, to the parents who have to shift and adapt at a moment's notice? Are we really doing right by our nation's children with our COVID response? Well, joining me now to share their opinions on this matter is Dr. Scott Masson, a professor here in Ontario, and Anthony Furey, columnist with Postmedia. Gentlemen, thank you so much for taking time out of your day. You're both parents here in Ontario, so I guess first off, how's your family coping with these repeated lockdowns? Scott, how are you doing?
We're laboring under them just like every other family, as you can imagine. But when this broke out last spring and we went into the summer thinking about what we were going to do next year, we decided to pull our kids from the school because I anticipated that the government would do what it did up to that point, which is to double down on their original premise that they needed to take extraordinary measures and shut down society to save us all from this virus, and that they would be unable to slow the spread of a virus because it's simply beyond the capacity of any government to do that. And that as a consequence, my family would be thrown into one crisis after the next with arbitrary and ever-moving sort of boundaries for what will constitute safe policy going forward. So we tried to control what we could control, and so we're partly homeschooling in some ways, but it's been a deprivation for my children.
And
for
Anthony,
sure.
Similar situation. Your children are feeling it as well?
Yeah, certainly. I mean, I'm grateful that we haven't had some of the more tragic stories that you're hearing out there that are very real for families. But, I think of how my youngest child just turned 3. And obviously, when you're a little baby, you don't really experience much of the world. So going from, just before turning 2 to 14 months later, I mean, that's pretty much all of his life as an aware human being. And he has missed so many experiences because of that, right. and missed really being able to have what is typical of a childhood. So even though we haven't had the more acute tragedies that you're hearing out there, I mean, we're definitely taking away people's childhood and teenage years. People who missed their sweet 16th birthday party are soon going to miss their 17th birthday party, and so forth. And all that vibrancy of youth is being denied.
It is. And we see through this recent McMaster Hospital report that it is having a psychological and emotional mental toll on our youth. In the 45 seconds before we have to take a break, Anthony, I recently interviewed Lexi Dakin, a teen in New Brunswick who, because of COVID, it led to the deterioration of her mental health and she took her own life. There's a lot of stuff happening here. I've quoted so many stats. Again, sorry, in the 30 seconds before we have to go and we can pick it up after. Is any politician listening to what's going on in this crisis? Anthony.
Well, they say they're listening. They say they're aware of the numbers. I've presented some of those stats to officials, live on camera during press conferences, and they nod and say, "Oh, yes, we're aware of it. That's why, we must soldier on," and so forth. And then they go on and they do introduce policies that do seem to exacerbate those very situations and numbers. So it should really outrage parents.
Yes, it will certainly outrages me.